Cherished Futures for Black Moms and Babies is a multi-sector collaborative initiative, and we bring together hospitals and health systems, public health departments, insurance payers, and Black women community leaders to look at how we create systems-level change to address the inequities that Black moms and babies and families face here in Los Angeles and collectively that we see across the nation.
The goal in Cherished Futures is to not only improve the clinical outcomes for Black birthing families, but also to improve their patient experience. And we do this by looking at institutional opportunities for change within our hospital systems.
Research has made it very clear that at the root of these inequities is racism. The impact of racism on Black bodies is not only harmful, but it's measurable. And so we wanted to make sure that we designed an initiative that would address, again, not changing the behaviors of Black birthing people and families, but really changing the behaviors of the system.
I'm a member of the Cherished Futures team at UCLA Health, and one of the benefits of that collaboration with Cherished Futures is the structure of accountability that they provide, that there are external coaches, external guides who keep us on a schedule, who provide context and content that helps direct the work that we're doing to improve outcomes in the hospital for Black birthing families at UCLA and across LA County.
I've really enjoyed my experience as a community advisor with Cherished Futures. We are in our second cohort. And I really think that the Cherished Futures team has done a masterful job of creating a quality improvement initiative that is focused on improving clinical outcomes, but places an equal value on improving the experience of Black birthing families. And in my time with Cherished Futures, I've worked with hospitals that are at different levels of organizational readiness when it comes to authentically and sustainably embedding this focus and priority on the experience of Black birthing families into their policy and practices. But I will say that the bi-directional learning experience in between the advisors and the hospital teams, layered on top of the technical assistance that's provided by the Cherished Futures team, really leaves everybody with just a better understanding of why and how to improve the experience of Black families.
Our amazing Community Advisors Collective consists of philanthropists, researchers, clinicians, all of whom are Black women and who are immersed in this work either professionally or personally in their lives. Because of their lived experience and their professional experience, we pair them with our hospital teams in order to have the Black voice heard at the table. This allows for our hospital teams to understand how better to work with Black women and to hear from Black women's experiences, because their experiences mirror the experiences of the Black patients that the hospitals serve.
In the United States, unfortunately, we see very high maternal mortality rates among Black women and birthing people compared to pregnant people of other races and ethnicities. And unfortunately, during the COVID-19 pandemic, we've actually seen those numbers increase, which means that we are compelled and required to act with a sense of urgency to address this longstanding issue.
I've seen a lot of judgment, and I've seen a lot of biases just come to the forefront when African American women present themselves in the hospital setting and in labor and delivery specifically. Such things as if she appears alone, she comes to our desk alone, it's automatically assumed that there is no partner involved or the father of the baby isn't involved, and that there is some, dire social issue present. Cherished Futures has done such an awesome job, honestly, about bringing the awareness of the needs of women coming into birthing spaces and requiring and actually receiving equitable treatment.
I really look forward to the day when Black mothers and families have everything that they need, both before pregnancy, during pregnancy, and after. And that when they go into space to receive care and receive services, that they're treated with dignity, they're treated with respect, and they're honored and celebrated. And I think we can get there.